on our website after the meeting. So I'm going to hand over to Louise and Ralph.
Thanks, Emma. We'll introduce ourselves and then we'll take you through the presentation. And just to stress, this is a local area, so it's not an Essex County Council approach, it's an Essex and CCG partners approach. So I'm Ralph Holloway, Head of SEND Strategy and Innovation at Essex County Council.
And good morning, I'm Louise Warren and I am the East of England Regional SEND Manager for NHS England. But just last week I was working alongside Ralph as the Designated Clinical Officer within Essex. Thanks, Ralph.
If we get the next slide, please. OK, so why did we decide we needed a dispute resolution process? It wasn't because we were constantly falling out and disagreeing with each other, but I think it presented itself because we had a pretty knotty problem that despite a lot of attempts to resolve, we weren't getting anywhere with it. And it was a particular case study that we're going to take you through in a moment. It had been there for some time and it was getting increasingly difficult. And I think the main driver was the impact it was having on children and young people, and we needed a process that would help us through that. And as the SEND audit tool in 2019 showed us a way through, we decided to adopt and adapt that for Essex and apply it to the situation we found in front of us. And it was really about finding a way through that problem in the most effective and timely manner. Okay, the next slide, please. So what was the problem? So we'd rebuilt an existing special school in Essex, and it had expanded as a result of that rebuilding. It sits in one CCG area, but sits pretty close to the border of another, and it also sits close to the border of a unitary authority as well. So children don't fall neatly into packages where children from one CCG attend a school in that CCG. They will attend the school that is best able to meet the needs of that young person. So as a result of our expansion of this school, we had a significant number of young people moving between areas into that school. There were questions then about whose responsibility it was to provide therapeutic inputs into the school. And we had a situation where the local commission services for where the school sat were unable to meet the increased demand, and it was significant increased demand. We then had a situation where the CCG where the school sat decided that they weren't able to make therapies for young people in the school who belonged to another CCG. And as a result of that, we weren't meeting our statutory responsibilities. More importantly, we had children and young people in that school who weren't thriving, progressing as a result of not getting the inputs that they needed. And at that point in time, we didn't have a clear communication pathway or decision-making process to allow us to resolve the problem we faced. Next slide, please. So after spending a lot of time basically communicating by email and having a lot of fruitless meetings, we looked at the dispute resolution process, and we used it as an opportunity to raise awareness of the issue. That was the first point, is we made those who needed to know aware of what the problem was and what the impact of that problem was. And it was decided that we would do a whole school audit of therapy provision. So rather than just looking at the children in isolation who were being impacted at that point in time, it was taking a whole school approach to the situation. That gave us the opportunity to have clear identification of what the issues were and what the need was in the school. And it also allowed us to decide where we needed to accept responsibility and where that responsibility sat. And it enabled more effective communication with the children and young people and their families. So rather than it continuing to be a conversation that was directed between perhaps two CCGs and a local authority, we were communicating more between the school, the CCGs and the parents and the young people who were affected by what was happening. And then from that, we were able to come up with a joint commissioning approach to therapies that meet the needs of the school and, more importantly, the needs of the children and young people within that school. Next slide, please. So there was a whole multitude of learning from this process. First one was about how we decide who's accountable at a particular point in time, how we decide who's responsible. So we were able to put in place clear responsibility lines to be able to deliver a more timely response to tricky problems like this that are entirely focused around the needs of the young person, that we had a process for agreeing and understanding responsibility, clear communication pathways and an escalation process. And there's one on there that's probably as important as all the others, and that's about commissioning intentions. It was really clear to us that an unintended consequence of making a decision to expand a school without doing it across the local area meant that we created a problem in terms of capacity in the health system, which means that when we commission new schools or expand schools in the future, we'll be doing it together across the education and the health system to look at the needs of the growing population within an area, but also thinking about the resource that needs to sit behind that school when we're expanding or indeed commissioning a completely new school. Next slide, please. I'm going to let Louise talk through the how.
Brilliant, thanks Ralph. Ralph's explained the concern, the problem that we had, and it did take nearly 2 years. So I think we're really open about these conversations, and we were really assured by the system around us that this wouldn't happen again for our children and young people within Essex, and that we would have a really clear form of communication. So how were we going to do that? We had it agreed at strategic level within our SEND partnership that we would focus on this, and we would develop a working group, a multidisciplinary steering group that included our parent carer forum as well, and the voice of the child. It was really, really important that we had them at the centre and the heart of all of our decision making. As we said, we had agreement at strategic level. Don't reinvent the wheel. We had some processes, certainly within safeguarding and continuing healthcare, that we could utilise, that we could use as a communication pathway, and the process that we have developed very clearly follows that same format. So many professionals and practitioners were involved in those processes, so it wasn't new to them. It wasn't something that they weren't familiar with. The piece of work, the dispute resolution, also helped us raise awareness of SEND throughout the CCG. Certainly from my perspective, not everybody knew what SEND was when I first came into post. This problem certainly ensured that they knew what SEND was by the time that we'd finished it. We raised it everywhere and spoke about the outcomes for the children and the young people. And as Ralph mentioned, it expanded by such a vast number of children were affected, and that has an enormous impact, and it has an impact on everybody that hears the number, and they want to do something around it. So we had buy-in and an agreement to change the culture. We needed openness, transparency and honesty. If I heard when I came into post, oh, well, I've written an email, I'm sure you've all heard it, well, I've sent an email, but actually where did that email go, who actioned it, and what did that look like? And as Ralph mentioned, we had a number of fruitless meetings, or meetings where we just couldn't find a breakthrough towards, sorry, apologies. So we started our dispute resolution process, and we knew it was best practice, and it was an ambition we were striving for. Next slide, please, Lucy. So this is our resolution of professional disagreement procedure. And the really key message for this morning is this is a communication tool. It is not a capability, a framework to assess how practitioners are working. It's not a disciplinary procedure. It's very clear that it's a communication pathway and a tool to enable really timely and effective decisions, but also so those concerns that we found can be actioned in a way that puts the child at the centre and ensures that we don't skim around the issue of who's funding, who pays, whose responsibility is. It really clearly outlines whose that is. The other really clear point to make around this isn't a tool for parents. This isn't. They should absolutely have an awareness, and they were part of the development of it, but it is not a tool for them to use. It's an assurance process for them to assure that we are talking to each other and we are communicating. And we were really clear that this procedure will ensure that most disputes are resolved at a local level, and that will ensure local practitioners are involved in the solution findings wherever possible. And it's only then, when we can't at a local level, that we then escalate it to assistant directors, social care managers, DCOs and commissioners, where we support following clear guidance and timescales. Thanks. Next slide, Lucy. So the communication pathway, as we like to refer to it, is what does it cover? Provision of services, as we've mentioned in our problem that we had, funding of services, who's going to pay, what does that look like, and where recommendations from health and social care and education can't be met, how do we come together to find a timely solution? And we had agreement across the Essex local area to adhere to this clear and simple pathway, that disputes would be raised and actioned really clearly with that open and honest culture that we discussed earlier. And that we had a governance process. So our Essex is a very large area. We have quadrant groups. We have 4 quadrant groups. The local area would take responsibility for identifying those and then escalating and feeding up any concerns to the SEND governance group for oversight and assurance. So these processes did not get lost, that they had strategic oversight and management and support if needed. Again, going back to that, I've sent an email, they weren't lost in the process. Thanks, Lucy. So these are our pathways, and I'm not sure whether they'll open, Lucy, on the presentation. I wondered if you could give it a go for me, just so that I can, they will open on your slides when you get them sent through, but they may not open on the presentation. Apologies, I should have warned you around that.
No worries, they're just loading up.
Okay. It was just an example to give you of what the procedure and the pathway looked like, but it will be on your slides. And the pathway is clear documentation about the actions that you've taken, the support that you've sought, and how we can support one another in finding a solution. Who's responsible? Does it sit with health? Does it sit with social care? Does it sit with education? Or with all of us? How do we work together? So I think they may not open, Lucy, so I won't take too much time. I think the other area to highlight is that at any point in this pathway, it can be resolved. You don't have to go through the whole process. At any point, we are looking for that resolution along the pathway, and it's only when you really can't come to a conclusion or a solution that we can then move that forward. I think it's probably doing all kinds of things, isn't it, Lucy?
Yeah, I think it's finding it a bit difficult to load, but here it is if you'd like to speak through it as an example.
Wonderful, thanks, Lucy. Sorry, I should have warned you of that. If you could just scroll down again, this is just an example for you all to see. I don't know if is it going to scroll down for you? Yeah, it will. So it's set out as if it were a procedure that we will work with, but really clear, setting out the purpose of it and how we will work together. I think that is the key message. How do we work together as a system to resolve these in a really timely way? And that, as Ralph mentioned at the very beginning, this was a partnership approach, not a blame, this is your responsibility. It's our responsibility for the children and young people across Essex. Thanks, Lucy. I won't ask you to open the other one because I think it might send the system into overdrive. Brilliant. Lovely, thank you.
No problem, everyone will be able to open this once we distribute the slides after the event as well.
Thank you. So next slide, please. So as we mentioned, how does it work? It's a communication pathway that can be started as soon as a concern is raised, a gap in provision, an area of highlight that we think may be going to cause concern. For example, we have obviously the therapy provision within the school. We've had a couple of examples of transport within Essex as well, and specialist school nursing provision, just to name some. How do we raise it and how do we come together to solve it? It's a consistent and robust communication tool to ensure that any disputes are resolved in a timely manner. I think it's worth saying here, COVID has had an impact on how we have disseminated this information, alongside the vast amounts of information and guidance that our system has had to absorb over the last 2 years. But we are We are committed to ensuring that this is embedded in our everyday practice. It isn't a disciplinary tool, and it's not to be used as a capability assessment against anybody. It is pure communication pathway, and we've seen that it promotes partnership working and real early identification of concerns and gaps. And I think even without using the pathway, we've definitely seen a shift, and hopefully Ralph agrees, in effective communication. We talk to each other much more openly now. We've got this here. How do we resolve this? How do we work together to solve the concern that is currently facing our children and young people? And next slide, please. So just some examples of impact that it's had in case studies. I've mentioned most of them. School out of catchment provision, which we spoke of before. How do we support those children and young people to ensure that they have timely and effective therapy provision and healthcare? Transport, we had a number of children that were being excluded from transport due to their behaviours. So I'm really interested in the new behavioural guidance and consultation that's coming out. How do we work together to resolve that? And what I would say is some really innovative ideas coming from our schools on how they can support the local transport provider and the system in ensuring those young people can still attend school. And provision of specialist school nurses. What does that look like in each of our areas? How do we talk to each other to ensure that actually we have a safe and effective and efficient offer across our local system area? So they're just some examples of where this has worked particularly well. Thank you. And that's me done. I think Emma's going to be really proud that we talked for 15 minutes. So we did all right, I think, didn't we, Emma, from that? But happy to take any questions or to clarify any points.
Fantastic. Thank you so much, both. If you have any questions, please drop them in the chat or put your hand up and we'll work through. We have 5 or 10 minutes just to work through any questions that anybody might have. So the first one we have is from Robert Hardy in the chat, and he wanted to know how schools are involved in the disagreement resolution process, or is it just the commissioners? I don't know if you want to expand on that.
Yeah, it's definitely not just the commissioners, and in the case study we used, it was very specifically about an Essex special school. So they were fully engaged in the process at all stages, and we, as I think we said in the slide, we did a audit with them. So it wasn't done to them, it was done with them to understand the need in the school. The head of the school is particularly forthright, and I think if we tried to do this without her, we would have ended up in trouble. But we've got a real commitment to this being about something that works across the whole of the system and not just the elements that we control. So it would be schools and settings embedded in it whenever we need them to be involved. Do you want to add to that, Louise?
No, only to say that it is around the embedding for the schools and knowing that it is a tool out there that they can use alongside our practitioners as well. So we mentioned schools and settings, but also our sort of healthcare professionals, knowing that they can utilise this, that they can escalate that within their local areas, and they have the support of that alongside our social care colleagues is, I think, the next stage to ensure that embedding process of that transparency and open culture.
Thanks both. Any other questions from the group, or any comments even if people are doing something similar in their areas?
We've stunned everyone into silence, Emma. Hopefully that was it was clear and people are understanding the process.
We've just had a comment from Denise. Denise, rather than me read this out, did you want to ask that question directly?
Yes, sure. Thank you. I've had, cases in the past where basically the conflict has been between the education side of things and social care. A particular example is if a family has won a tribunal for a residential school, and social care obviously don't agree that this child requires residential, so they don't agree to pay the residential component of that placement. There's obviously educational component and residential component of that placement. So the entire cost has fallen to the educational or SEN department, if you like. I was just wondering, have you come across any disputes similar to that where, your resolution process between professionals has been helpful?
think I'd be unlikely to win that one, if I'm being honest with you, as the budget holder for the residential component of tribunal decisions. I can't think of a situation where that's likely to end nicely for me. I think the question below about where we're looking at borders outside of Essex is also one we've not tested. So it's very much a local area, and that would include social care, but it's a local area rather than cross-border into other authorities. I've not tested it in terms of where we've got a decision where we might have an Essex child placed out of area, and I've not tested it where we might have a dispute internally to one of the organisations. So that is an internal dispute between social care and education. Mm-hmm. All I can say is that we've got one director of children's services, so I think I know which way it would go.
I think, Denise, if I can add into that, I think it could absolutely be used for that type of discussion, shall we say, in terms of what that at a very early stage. Because if it's got to tribunal, we're hoping that everybody's been talking to each other much earlier on, and actually how have we come to that decision, and when we go to tribunal, do we already know that social care don't feel this is the best, you know, where can we use? So again, it brings it back to that communication pathway, doesn't it? And then if that decision is going to be made, does everybody know about it? There is something around, you know, senior leaders taking responsibilities for those decisions as well, but they have had the information and the communication that we've provided them to ensure that the child's needs are being met, but actually they're not. I often hear parents saying, well, who's funding it? They need to find out who's the funding going to be. Parents don't need to know that. Parents don't need to know the argy-bargy that we all know goes on, and I know they do know that, and maybe I'm really blue sky thinking around it, but this way hopefully will ensure that we have a much more effective and smooth, seamless communication process, rather than a, you know, it's going to land this way type of thing. So again, as we said, we've not embedded it with it all, but that's definitely somewhere where I think we envision it to be in time.
Yeah, definitely take that conversation would be downstream of the tribunal, and I think that the comment there about whether the outcome was due to tribunal fin there was an educational need would be crucial here. If we felt there was definitely a social care need, I would be pushing harder on the contribution. I guess one of the factors in Essex is that we have an arrangement where education bears 73% of the cost anyway, so I'm not going to recover much of the cost regardless.
Yeah, absolutely. Jill's had a question. Am I right to answer it, Emma? Sorry, I've done your bits, haven't I? Jill, has it worked? We've not particularly needed it, if I'm honest, in terms of out of area therapy, other than obviously the example that Ralph, which is probably our biggest one about therapy provision out of area, even though it was in the Essex local area. But absolutely, but what it would probably work for is your area. So you would have a really robust and comprehensive sort of communication flow and documentation of the actions that you've taken, so it's not lost within the process. And I think sometimes, certainly as DCOs, we need that additional support, don't we? So you can escalate it within your organisation and the responsible local authority for that child to say, this is what I'm doing. This is what I've done for this child to resolve this therapy provision, because we've all got different arrangements. In Essex, we've got different arrangements, as you can see, and it becomes even more complicated outside of that. So it's absolutely something that I could see would support in that, or support you in your role of escalating those concerns. Is that helpful?
Yeah, thank you. Yeah, it is helpful. We are having a number of cross-border issues with parents who want dual placements. And particularly one within a local authority area and one without, and therefore who should provide therapy on both sides. So yeah, just wondering whether I can adapt it. Thank you.
I think you probably could, yeah, from experience. Yeah, definitely.
Fantastic. So I think that's most questions, but if you want to get in contact with Louise or Ralph, they provide their contact details, which we will share on the slides directly after the meeting. So just a massive thank you to Ralph and to Louise for joining us today, and we'll move on to our next session. So thank you very much both.
Thank you.
Thank you.
Thanks all.